And joining me now from Capitol Hill is Democratic Senator Maggie Hassan, a member of the Health, Education, Labor, and Pensions Committee, and former governor of New Hampshire, which has been front and center in key part of the health care crisis, the opioid epidemic. Senator, welcome. I know you also have a very personal perspective on the challenge that many families face dealing with pre-existing conditions, and I want to talk to you about that. But we do have breaking news at this moment. We understand that another Senator, Murkowski, is saying that she would oppose the motion to proceed. We don't know, the numbers yet, but it doesn't appear that they have the 50 votes for a motion to proceed.
Well, thank you, Andrea, for having me on today, and that's what I'm hearing, too. And look, the plan that Senator McConnell has been putting forward since last night, this repeal bill from 2015, would cause premiums to skyrocket. It would cause about 32 million Americans to lose their health insurance coverage, and it would eliminate Medicaid expansion, which has been so critical in my state and many others in addressing the heroin, opioid, and fentanyl crisis. So it's an irresponsible plan. I am heartened to hear that Senator Murkowski has joined Senator Collins and Capito in saying she won't move to proceed. Democrats are really eager to sit down with our Republican colleagues, get back to regular order, and really talk about how we move forward to improve the Affordable Care Act, fix what isn't working well, and build on the health care system we have so that all Americans have access to affordable health insurance so we can all be healthy and strong and our country can thrive.
I wanted to play a little bit of the Senator Murkowski comments that we just got in. Let me play that for you.
Sure.
A motion to proceed on this repeal and then replace.
I'm not there.
Not there?
Nope.
You would vote against the motion to proceed?
I said in January we should not repeal without a replacement, and just an indefinite hold on this just creates more chaos and confusion.
Thanks, Senator.
I think we also heard from Rob Portman that he had some concerns about it. Doesn't mean he's a firm no. It doesn't appear that this is going to go anywhere unless he can turn some Democrats.
Well, I don't think you're going to see any Democrats voting to proceed with a bill that would, as Senator Murkowski's comments just indicated, create chaos in the marketplace, rip health care coverage away from 32 million Americans, cause our premiums to skyrocket, and undermine seriously our efforts to combat the opioid crisis. We have ideas in the Democratic caucus about how to move forward and bring health care costs down and stabilize the market. Among other things, we have to bring prescription drug prices down. And so we should be allowing the importation of safe and affordable prescription drugs. We should allow Medicare to negotiate with pharmaceutical companies for prices. And those are some of the ideas that we have that would really help us bring down costs. We have other ones. We were just on the floor talking about how we could stabilize the insurance market and further bring costs down, too. That's where our attention should be. And I am hopeful that this means we will return to regular order. I'm a member of the Health Committee that sets health policy in the United States Senate. We'd really like to actually have a hearing on health care reform and how to move forward.
Now, you, as everyone, lives it day in, day out, but you have a special interest. Tell me about your son, Ben, and how people like Ben benefit from the coverage that would not be available if Obamacare is repealed.
Right. Well, so my husband Tom and I are blessed with two terrific children. Our oldest is Ben, who's 29 and happens to have very severe and pervasive cerebral palsy and a lot of medical complications that go with that. So he gets most of his nutrition through a feeding tube. Ben can't speak or walk or really use his fingers to access a keyboard, but he has a smile that lights up the room and he can communicate with very basic gestures. And, Ben obviously has a lot of pre-existing conditions, and should the protections for people with pre-existing conditions go away, he would be deeply impacted. He has a lot of medical care that is actually covered by Medicaid, not our family's private insurance, because even though our private insurance is excellent insurance, most private insurance doesn't cover the kinds of supports and extra care that someone like Ben needs in order to be able to live at home and be a member of his community. My husband and I are incredibly aware of both the strengths and the flaws of our healthcare system. At times, Ben has had as many as 9 or 10 doctors and up to 20 medications. So we know that there are improvements we need to make. We certainly have to do more to bring the cost of healthcare down. But you know, in order for us to be productive as a country, people have to be able to be healthy. And we've heard story after story, as I just did in New Hampshire on Friday, from people who got coverage through Medicaid expansion, whether it was for substance abuse or some other kind of health care need, and are now working, some of them working for a private entity and getting private insurance now. So there is really a possibility to move forward. It starts with the basic principle that every American counts, every American deserves access to affordable quality health care, and when they do, we all get healthy and thrive together.
Thank you so much, Senator. Thanks for your perspective, your first-person experience with Ben, with your family, and what you've done as a family. It's very meaningful.
Thank you. Thank you very much. I appreciate that. Take care now.
You too.